Hey guys, welcome back to my channel. It's your girl, Island Girl Shan. If this is your first time here, welcome. Of course, make yourself at home. But if you've been with me since day one, thank you so much. I appreciate the continued support. Of course, don't forget, if you haven't done so already, click the subscription down below as it really supports my channel and I really appreciate it. Okay, I'm going to get straight to the point. I am going to tell you what to expect on the ATI Proctored Med-Surg exam. Hopefully this helps you with studying. If you are preparing or currently studying for that exam, this will help you to narrow down and focus in on subject topics. Not saying that you don't want to review all subject topics, but this will actually help you to kind of, focus on areas that you might not have been thinking about. Okay, so first things first, before you do anything, know your lab values, because there were a lot of questions that they were asking, and the simple fact that I knew what lab values were within the expected range and what were out, I didn't have to read the question. I mean, I did, don't get me wrong, I did read the question, but when you go down the list and you can pick out which one out of the 4 options is out of range, that just made the question so much more easier. So I highly advise, know your electrolytes, know your CBCs, know your lab values. That will take a whole lot of pressure off with a lot of the questions that they ask. The next thing is cardiovascular diseases, symptoms of diseases, what other organs that they affect, how they manifest. You got to know it. Know procedures that they do, what you would monitor for. Know cardiovascular in and out, and know how it affects other organs. If you're having heart failure symptoms, how would that affect other organs in relation to that heart failure, whether it be the lungs, the kidneys? Know these things. It's important, and it showed up on the exam. Speaking of kidneys, know the renal system, know signs and symptoms of diseases, how they occur, know pre-renal, renal, and post-renal causes of acute kidney injury. Know how the kidneys affect other systems within the body. Know what the kidneys do, because if you know what the kidneys do, you will know when they're not working, what will be off. Okay, so know those things. Know the electrolytes, know all of them, because those all come into play. I saw questions about, kidney injury, what to expect as far as electrolytes, kidney injury, what to expect as far as the blood pressure. Know them, okay, because it's important. Another thing is know about signs and symptoms of increased intracranial pressure. So if the patient has had some type of issue that you suspect is causing increased intracranial pressure, what's the signs and symptoms you would look for? How would you assess that? How would you treat it? What would you monitor for? Those are important. So intracranial pressure and spinal cord injury are important. Know about the eyes, diseases of the eyes, normal responses of the eyes. What would you know, or what would you assess as far as if a patient is telling you they are having eye issues and eye conditions? What would you suspect? Another thing is there was a couple questions about the gallbladder and the pancreas. There wasn't a lot, but I would advise you to know those. Just know diseases of the gallbladder, diseases of the pancreas, and what would those affect. If those are off, those numbers are off, what would you suspect? Arthritis, know that. Know diseases of the joints. No medication, because there was a couple of farm medications. So when it comes to diseases and organs, know the medications that you would use to treat certain organs. So if you're studying the heart, understand the heart medications. If you're studying the kidney, what medication would you use? Also, before I forget, know the blood, no blood transfusion. If your patient is getting a blood transfusion, know what steps you would follow to give that blood transfusion. Know what you would mix with the blood transfusion. Know TPN. If you're giving your patient total parenteral nutrition, what would you look for? What would you assess for? What is a side effect? What could be happening to the patient? So what would you check for? Also, if your patient is on TPN and you don't have the TPN right then and there, what other thing would you give to the patient in the meantime? And to be honest with you, that's about it. Most of the questions revolved around that. There is 100 questions on the exam. You get an hour and 40 minutes, but only 90 of them count. I think 10 of them are like dummy questions. So just keep that in mind. And that's it. It wasn't a lot of respiratory. It was a few questions, but it wasn't a lot. So I would advise you to review respiratory, but it was not a lot. There was a couple. And that's about it. I wish you the best of luck on your exam. And if you have any questions, feel free to drop a question down below. You know, I'm really good about responding. And like I said, I wish you the best of luck. Thank you for stopping by. Bye.